Hello, so welcome. Today we'll be discussing vaginismus. It's an unusual topic, but it's a very common condition. It's just because of the stigma associated and because this is an environment people don't talk about things like that. Most people don't own up that they are suffering with such a challenge. So chances are you got here because there was a burden in your heart. You had some concerns that you wanted to shed some light on. So welcome, welcome. I'll give you a couple of seconds to just get yourself together, find a chair. And if you want to make some notes, find a jotter and a pen. But by all means, get comfortable so that we can learn one or two things. All right. By way of introduction, vaginismus is a condition that, if I would describe it in simple terms, it just means it's a vagina in panic. If you've ever had any condition that sets you in a state of panic, you know what I mean. It's a fight or flight response of the nervous system. And it literally means such an individual is afraid of pain, is afraid of penetration. It is inherently a psychosomatic condition. It's not an intrinsic abnormality of the vagina. It is a disconnect between the mind and the body. So it sets such an individual in a state of panic, that is contraction of the vaginal muscle. So it's an involuntary, and by involuntary I mean it's unintentional. The individual is not doing it. Tensing of the vaginal muscles. And people would usually experience this at the start of sex, or while they're inserting a tampon, or while they're getting a pelvic exam. It could be a routine pelvic exam, or it could be in the process of childbirth. Being a physician, one of the pointers to such is when it's very difficult to do a vaginal exam for someone who is in labor and needs to birth a baby. It's almost like a tug of war for some people. It's just a pointer that there's a possibility of vaginismus going on in such an individual. And it can make intercourse painful. The medical term for that is dyspareunia. Now, this would not usually affect sexual arousal. So the challenge for husbands many times is if you can get aroused, so why can we not consummate? It's important to know that vaginismus will not affect the woman's sexual arousal, but it will affect the act of penetration. And the spasms may be mild, mildly uncomfortable, or it could be excruciatingly painful. Now, as to the statistics, I must say that because it's a condition that many people are too embarrassed to talk about, their healthcare providers or even society generally, the statistics I would state may be a far underreported statistics. But the incidence is said to be about 0.5% in the general population. I believe it's more than that. However, a Swedish study alluded that it could be up to 5 to 6% of the population. But it's more commonly seen in women who have sexual problems. Psychosexual, simple term, psycho, mind, sexual, sex. So there's a disconnect between what they think, what their mind imagines, and what they experience. And these are the ones, that's about 12 to 40% of those who present to gynecology departments with similar symptoms. Now there are two types. There's the primary and the secondary. Primary vaginismus is when a woman has had pain every single time something has entered the vagina. That would include a penis in a penetrative sex, or whenever they've been, or when they've never been able to insert anything into the vagina. So someone who from the very first day of marriage has experienced pain up till today. That's a primary form of vaginismus. It's also called lifelong. Lifelong, not for the rest of their life, but lifelong, since at least something went into the vagina. Now, secondary is when a woman has had sex without pain before, but later it becomes difficult or impossible to penetrate the vagina. It's called acquired. There are a couple of things that could cause that. It could be a traumatic birth. It could be some traumatic or insensitive approach to some gynecologic procedures. There was a woman who developed vaginismus after she went for a routine pap smear, and the gynecologist who asked, "You're not a virgin, right? You're not a virgin, right?" and just shoved the speculum into the vagina, and that sent ripples of shock waves into her system. And from there on, she developed vaginismus, and it was an issue that needed to be resolved. This is a woman who had had a wonderful sexual experience with the husband before, who has birthed babies without any problem. Now, there's also a grading. This grade 1. This is one when there's just contraction around the muscles at the entrance of the vagina. So a finger wants to go in the process of vaginal exam, or the husband needs to penetrate. The contraction is just at the entrance. Grade 2 is when there is complete spasm of the whole muscles of the pelvis, and for that it may be almost impossible to penetrate. And if the husband succeeds in penetrating, it will be a very tight experience, so to say. Then grade 3 is when there is an elevation of the buttocks and the closure of the thighs, preventing an examination because of the involuntary contraction of the muscles. So in this case, someone comes to the hospital for a pelvic exam. While you're even trying to insert the instrument, maybe a speculum, whatever the physician wants to use, the individual would literally lift the bum of the couch and close the thighs, such that it's impossible to even perform the exam. And grade 4 is when there's closure of the thigh and the individual says completely refuses the examination. And reflexly, such an individual would also back up, almost like they retract from the examination couch. Now, the causes are varied, the causes are complex, but some of the common causes are past sexual abuse or trauma. There will be survivors of childhood sexual abuse. There will be survivors of rape. Then past painful intercourse, especially if the very first one was a very painful experience. So that sows the seed of fear, anxiety around anything penetrative. Okay, then, like I said, someone who has had a traumatizing pelvic exam, like the woman I mentioned, who had a normal sexual experience with the husband, who had birthed babies, but was traumatized by this medical personnel because maybe he had a lot of things to do. It was just insensitive, and the question was, "You're not a virgin, right?" And there was no preparation, there was no gentleness, there was no kindness to the approach, and just shoved the speculum into her vagina. Then now, religious and cultural factors. What do I mean by this? There's some religions that would ingrain it in young girls, even from a very young age, that sex is bad, sex is a sin. Some cultural factors would also teach virgins that you should expect that it will be painful. If it's not painful, it means you've been a loose girl. So what do you expect? Such people enter marriage with a fear, with anxiety, with expectation of pain. Now, if they are unfortunate to also have been married to someone who had no form of sexual education whatsoever, a young man who just believes that sex is just to satisfy himself and there's nothing in it for the girl, and just penetrates, no foreplay, no lubrication, no relaxation whatsoever, it's going to be a painful experience. And then, based on how insensitive this young man is, he could then continue to shame her. "Why are you so relaxed? What's wrong with you? We got married so we can have sex. Or sex is supposed to be part of the marriage package," and on like that. So this will reinforce this cycle of pain, discomfort, worries, fear, and anxiety around the act of sex. Then, of course, erroneous sex education. This would also still be alluded to cultural factors and sometimes religious factors. So these are the common causes of vaginismus. However, it's said to be that there are a couple of people for which there is no cause. But in my own opinion, these are also people that have a lot of psychological baggage. So their fight or flight response is heightened generally. So to the least of the stimulus of any sort, their fight or flight response will kick in. And the muscles of the vagina and the pelvic floor could literally contract. So as to the diagnosis usually will begin with the patient explaining their symptoms to a doctor. And the doctor would likely ask, when was the first time you noticed the problem? As you know, how often does it occur? What are the things that seem to trigger it? And typically the doctor would ask about your sexual history, which may include questions about if the person has ever had sexual trauma, was ever a victim of abuse, or ever a victim of trauma, of rape, and the likes. And in general, the diagnosis and the treatment would require a pelvic exam. It's common for women with this condition to be very nervous and fearful about the pelvic exam. So if you find that you're going to the hospital, your heart is racing, you're really scared about it, it's normal. So, but when a doctor suspects vaginismus, they should generally perform the exam as kindly as they can be. And it will not hurt as the client, as the patient, to ask the doctor to explain what he's going to do. The worst you will get is a no. So you can always ask. You can always read around it. So at least you are abreast of what to expect. Nothing comes as a shock. Nothing comes so completely novel to you that can kick in your fight or flight response. The treatment is multifactorial because the causes are multifactorial. But some identified treatments that have been found to be effective are counseling and therapy. Keeping in mind that most people with this condition have a history of childhood sexual abuse or rape or traumatic pelvic exams or traumatic childbirth. Counseling to unravel the layer of trauma that has built up. Just, yeah, that. And of course, this would eventually allow the fight or flight response to lay low and not kick in haphazardly, kick in only when it is necessary. Then they would also benefit from sex therapy for both couples, because why it is the woman's problem once they are married, it is the two of them's problem, because their sex life could be very well out of the window or on its way out of that marriage if something is not done quickly. So finally, finding a sex therapist who is skilled in the management of vaginismus and both of them being intentional about going for the therapy is also one of the ways that it can be treated. Then of course trauma therapy, because as I said earlier, it comes from sex trauma, will also be beneficial. It's been said that serial dilatation helps the individual to relax. So there are medical dilators, there's a dilator kit that comes as a set. The smallest may be as small as a finger, and the largest may be the girth of the client's husband's penis. Just a serial dilatation so that the vagina gets accustomed to that size. Then guided meditation, visualization, and progressive muscle relaxation have also been found to be beneficial. This is why for those who experienced trauma, especially for childhood survivors. Now, trauma freezes these memories in time. So there's a 30-year-old woman who has a frozen memory of a 7-year-old. When this fight or flight response will kick in, logic cannot explain that. Because the woman knows, this is my husband, we are married, he's not raping me, I consented to this, so why am I contracted? Why am I feeling pain? It goes beyond just explaining. The guided meditation, the visualization, the progressive muscle relaxation, when it is done repeatedly, eventually builds this attitude of relaxation into the subconscious, and also would, over time, help to take down some of these trauma imprints, if I may, almost like you're building new patterns. So there's this old trauma imprint of fight or flight. Anything goes in, we contract. So building a new pattern over time of anything goes in will relax, provided it's my husband with whom I have consented. So guided meditation, visualization, progressive muscle relaxation is wonderful for this and is highly beneficial. But the clause is it takes time. It's not a one-off thing. So usually would suggest that such an individual commits to at least 21 days of such. And of course, we'll now see how it goes from there. Then it's also been said that botulinum toxin, Botox, lidocaine injections may be beneficial. The way it works is that it numbs the muscles around there, so the individual is not able to experience pain. But as to the long-term effect, it's questionable. May work in the interim, maybe for pelvic exams, for pelvic procedures, but it doesn't sound practicable for sexual relationship with one's husband. So I have a note to the husband because, like I said earlier, it's not the wife's problem. Now it is the couple's problem because, like it or not, the husband would also experience some discomfort from this challenge and it could put the marriage in some form of tension. It's important that during the acts of sex, there's lots and lots of lubrication. The mistake that men make is because they don't need lubrication, they assume that the lady may not. And coming from a very innocent background, most ladies don't know much about this. So lubrication makes it easier, allows her to also relax, and would reduce the friction. Then of course, lots of foreplay. Let it not just be that the husband is interested in penetration all the time. Lots of foreplays would also take down the fight or flight response, will reduce the anxiety, will reduce the fear of the potential pain around the act of penetration. Then give time to non-sexual touch as much as possible. Let it be that the spouse has built up some rapport by some non-sexual touch before the act of penetration. Then it's important when it comes to the eventual act of penetration that the timing has to be the wife's. What do I mean by this? It is not when you're ready that you're ready. If you go in before she's ready, you will just set up and activate a fight or flight response. Will lead to contraction and you may very well not be able to achieve anything. Then in the event that you guys did not you and your wife did not have a successful penetrative sexual encounter, if I may use that word, it's important that the husband offers emotional support. Not that you shame her, not that you blame her, not that you're angry. It will just further reinforce the negative feedback around the act of sex. And it's a lose-lose for the marriage, it's a lose-lose for the sexual relation in that marriage. Then it's also good that the husband understands the disorder and the cause in your wife. So what happened to her that she's so contracted? What happened to her that she's not relaxed? In fact, having a wife who has vaginismus is a pointer to a need for some inquiry. Ask her what happened. There may be some stories that she's repressed. There may be some stories that she's never told you. This may be the time to inquire and ask what happened. What's your fear? What do you feel when I'm about to go in? It's good that the husband understands the disorder generally and also understand the cause in his wife, since it is like an individual problem. Then patience. You cannot be too patient with vaginismus. Then it's better to aim for small wins, non-sexual touch, foreplay, than to aim for that eventual goal of penetration. If one will eat an elephant, it's not in one day. Marriage is lifelong. Taking a couple of months in the initial phase to build this rapport so that our defense mechanisms, the fight or flight response begins to calm down, and the small wins you get from that would eventually accumulate in the final win of being able to consummate appropriately. So I hope that this is helpful to someone. I hope it's helpful to some couples. I wish you well in your sexual relationship. I wish you well in your marriage. Bye.